I am happy to welcome you here today and about 70 of our colleagues who are joining us on Skype. Can we wave to them? Well, they won't see us if we wave, so can we say hello, Skype people? Throughout the stellar enterprise, we continue to advance health equity and address health disparities. And as you've heard, Minnesota is one of the healthiest states in the country. And before you applaud, listen. It's also one of the states with the greatest health disparities. So as part of the company's social impact work, we are addressing gaps in health care access, affordability, and quality. It's exciting, innovative work, and one of the reasons why the company celebrates Health Equity Month. So usually, Health Equity Month is in April, but this year, it was an interesting twist. The theme for Health Equity Month was active and healthy. So how do we become active and healthy in April and go to bed the rest of the year? So we decided that we were going to do active and healthy all year round. So new this year, rather than focusing our efforts on just 1 month, April kicked off a full year of promoting ways to embed health and health equity into our everyday business practices while living more active and healthy lives. This year-long focus is a direct result of all the feedback from the 2018 Health Equity Survey, where you all told us that you know what health equity is, but you wanted more help in understanding how it affects you and how it connects to your daily work. So at this point, may I see by show of hand in the room who all has filled out the Health Equity Survey? Don't be shy if you haven't. There's still opportunity for you to do, so you need to redeem yourself and complete it today. Thank you. So for those joining by Skype, we will be sending the presentation right afterwards. And the session is also going to be recorded, so be on your best behavior, those in the room. In April, when I saw the theme for Health Equity Month, I thought of Dr. B right away. But he was in Chile, and now he's back in Minnesota. So Dr. Joe Baumgartner is a board-certified physician with a specialized fellowship in non-surgical orthopedics and sports medicine. He believes in the body's ability to heal itself when given the proper direction. Dr. B will speak on the topic of a healthy lifestyle. He utilizes the latest in diagnostic and treatment technology to better treat, this is a big word for an African woman. Is it muscular? Okay, I won't say it, but something to do with the muscles. And he teaches about pain and his unique brand of medicine to other practitioners. As an international speaker, he instructs both physicians and those in the medical industry on pain evaluation, diagnosis, and the latest treatment options. So all of us here at Blue Cross and Stella, we are in for a treat because Dr. B has a new national bestseller called Regenerate. So join me in welcoming Dr. B to Blue Cross as we learn to regenerate our lives. Thank you.
Thank you. It's great to be here. So, yeah, we're going to talk today about health, and it's, I guess, appropriate that we're talking in a cafeteria where you guys are eating, so I hope I don't make you feel too guilty based on the decisions you made when you purchased your food today. So we're going to talk a lot about, kind of health and nutrition and just what we can do to make a healthier society, because you guys are involved in healthcare on the reimbursement side of it. So what you guys have the ability actually to help people become very healthy. But I'm going to talk about what I call the C.F.A.N. model, which is the model that I've kind of put together that looks at everything to create health in our society from a lot of different angles. But I want to tell a bit about my story because it's kind of a journey and how we all get to where we're at. But my story goes way back to when I was just a little teeny dude, and I was a little dude. And you can see my brother, he's 3 years older than me, but he was like 4 times my size. So he was destined to be a football player. He's destined to do great things. And I was little, but I was also an athlete and I was competitive. But my mom, who's in that picture, was super smart. So at a young age, she's like, okay, Joel's little, but he's powerful, so I'm going to put him into gymnastics and tennis. Jimmy, I'm going to put him into football and the big guy sports. And as a little kid too, I was actually super creative. I was outside the box. I was really good at art. I could draw anything. And so my mom saw I had a really creative side as well. So she kind of pushed me into the arts as well. And eventually in college, I actually became an art major, and it was pretty awesome. But the problem was when I was little, we lived in all these big cities down south. We're moving around, and my dad was in the military, so we moved from place to place to place. And I did keep excelling in gymnastics, and I was really good. But when we retired, he retired out of the military, went to North Dakota, into the small little town, North Dakota, where football dominated, so did rodeo. Here I am, this little shy, in 4th grade, and I was a gymnast, I was a tennis player, and I was an artist. It did not fit into that culture. So I remember being a kid being bullied, being called, certain names, and but I was pretty cool. I felt confident in who I was, but I learned to be outside the box as a little kid. I learned that it was okay to be yourself. It was okay to be different. It was okay to be an artist in a cowboy country. So I learned early on to be myself, but I was also broken as a little kid. I had a low self-esteem. I didn't like who I was. I didn't like the fact that I was good at art, yet I loved going to my room and drawing. But it was really cool in high school, or even in junior high, I met a couple good friends who thought I was super funny. They laughed at what I said, and they liked my creativity. And by the time I graduated from high school, I was, voted, most influential in my class. I was student body president, and so I kind of learned to deal with being different, but channeled that energy into a really positive way to, be who I was. And as a senior in high school, I remember there was 2 freshmen. They're these little girls, and they were different. They were little German girls, bright red hair, curly, with super low voices, and they're chastised in our high school. They were made fun of. And I felt for those guys. My sensitivity came out, and I just felt terrible. I was like, that was me 6 years ago. I was a kid made fun of because I was different. So I walked those 2 twins to every class they had. I was like their one and only friend. I bought them gifts at Christmas time. But I infused confidence into them as well, and they grew up to be normal people. We're friends on Facebook, and they've got lives and kids, and it's not because of me, but I learned something is that it's okay to be sensitive, and it's okay to care for people. And when I went to college, I was going to be an art major. It's like I was creative. I love creating things, but I also love to challenge myself. So my parents were never putting pressure. No, you should go to medical school. But when I was a freshman in undergrad, I just took a summer job as a nurse's assistant or nurse's aide. Has anybody ever been a nurse's aide or a personal attendant for anybody? So it's the most humbling job in the world, but it's the most gratifying because you get to deal with people at the end of life, when they're dying, when they're struggling, when they're, at the end of all the stuff they've put life into. And they assigned me to this lady named Barb. And Barb was a stroke patient. She had multiple strokes, and she's in the nursing home, and she couldn't talk, and she scratched her face and had ulcers everywhere, and she had to wear gloves. And so my job was basically to feed Barb and to put her to bed and to change her and to bathe her, and she didn't talk. And so I did it for about 2 weeks, and I was super kind of bored with the job. So I thought, I'm just going to talk to Barb. So I started talking to her about this redhead girl who I thought was really cute. And I was like, Jen is really cute, but she doesn't like me. I want to ask her out, but should I? And then I started noticing that Barb started to smile a little bit. So there's somebody inside there that nobody ever, they just thought she was just a vegetable and just feed her, put her to bed. But fast forward to the end of that summer, Barb had her gloves off. She was feeding herself. She would talk to me. She'd tell me about her husband, Joe, and how she didn't like him. But it was really cool. And so at the end of that summer, though, I'd pick her up out of her wheelchair, I'd turn on the radio, and then we'd kind of do a little slow dance, and I'd whisper, Barb, I love you, Barb. And she'd whisper back, I love you too. And then I'd put her to bed, and I'd tuck her into bed. But I realized at the end of that summer that I wasn't destined to be an artist, struggling in some box. I was destined to help people. So I called my dad. I was like, Dad, guess what? I think I'm going to apply for medical school. I think it's pretty cool, and I think I can help a lot of people and reach people's lives and make them healthy. So I was super excited. So I changed my major. It was a double major, so I did finish my art degree, and I still love art and creating things. But I said, okay, God, if you want me to go to medical school, help me to get the grades and get accepted. If not, I was fine being an artist. And then fast forward 4 years, my senior year of undergrad, and you get that letter in the mail after you apply, and you get to figure out if you're going to medical school or not. And I opened it up and had my dad on the phone again. I was like, okay, here we go, Dad. I read it up, and the first word is congratulations. So my destiny changed. Okay, you're going to be a healthcare provider. You're going to help people, which was awesome. Went through medical school, got into my residency. I did a residency in family medicine or primary care, which you guys know a lot about because you all have doctors. And it was okay. I went through it and I felt, oh my gosh, all I'm doing is patching people up. I'm in a system of seeing 30 patients a day. I'm writing prescriptions, and I kept seeing my patients coming back the same size. Diabetes was not getting better. The A1Cs weren't good. Prescribing more medication, then they're depressed, then antidepressants, and 5 more minutes. And it was just chaos, and it wasn't gratifying. It wasn't that feeling I had when I gave Barb a hug and said, I love you. It wasn't that I'm making a life change in someone's life. So I applied for another fellowship and got into a sports medicine, non-surgical orthopedic fellowship, dealing with athletes, chronic pain, and that was kind of my channel too. I loved movement, I love athletes, I love performance, and I love bones and joints and anatomy, so that made sense. So went through that fellowship and got out, and I was kind of like revitalized again. This is great, this is awesome. Started working for a large healthcare organization, and all of a sudden found that I'm under the gun. You gotta see more patients, you gotta get more patients through, you've gotta build more things out, and finally what was awesome is that healthcare, it was a large organization, left my town. And they said, okay, thank you, you have 60 more days, but we're leaving town and we're going back to the cities. I live in St. Cloud. And so I said, well, what the heck, I'm gonna do this on my own. I'm gonna start my own little clinic. I'm gonna be independent, which is really hard, if you guys know, to survive as an independent physician in this kind of market. And I'm just gonna do healthcare the way I think it should be. So that's kind of where the story started, and that's kind of where I am today, is I've created a healthcare model that truly creates health in our patients. And that's what you guys do too. You guys are providing the means for people to get healthy. But my goal is I don't want to prescribe more medications all the time. I prescribe medications every day, but only when it's needed. I send people for surgery every day, but only when it's needed. There's so much we can do to prevent a rise in costs in healthcare and stuff. So what we're gonna get into now is a little bit about that. And so what happened is I opened up my own clinic, and what I wanted to do with my clinic is I wanted to have half of it a medical clinic focusing on primary care and orthopedics and those types of things. But then half of my clinic, I wanted fitness, education, nutrition counseling to really create health in my patients. So it was me and one nurse. Like I said, I lost my job. I had no money. My bank account was dwindled. I had no money coming in. It was pretty bad. So this is my first gym. It was just a single room, and we had some fitness facilities, and I hired a trainer that started talking about nutrition. And then I had another nurse who educated people on, exercise and how to eat and lifestyle type stuff. 2009, 2010, it started getting some momentum. We started getting people, yeah, I'm gonna change my life. I'm gonna start working out. I wanna learn more about nutrition. So then we rented a warehouse, and we kind of built this place for group training and group classes, and it was pretty exciting. And then a few years ago, we opened up what we call our kind of like, this is the way healthcare should be. Every healthcare facility should have a huge gym attached to it, and then you should have your clinic that does the stuff that you need to do on the medical side. So we opened up Rejuv Medical in 2015, and we love what we do. We have like employees that are motivated, just like you guys. You're here learning more about your health because you love what you do in your healthcare. And so it's been a really fun ride, but to make it successful, to survive as an independent, you have to be creative, which is awesome, because I was a creative young kid. I learned to be okay outside the box. I learned to be okay to have no friends and do things on my own, although I have some friends now. But it helped me to look at the current healthcare model, and our current healthcare model looks like this, right? We have orthopedics, which we all need. You break a bone, you gotta have someone put back together, but we don't need more cortisone shots all the time. We don't need more narcotics being prescribed. We don't need to take more NSAIDs because of the risks. When it comes to primary care, we don't need more antidepressants if you don't need it. You don't need more hypertension medications. We need to start changing our focus to disease prevention. So that's what my clinic focuses on. And then in community health, right, in our kids in our school systems, we don't need more lunches that are unhealthy. We need lunches that are well balanced. We need education on nutrition so the kids learn how to eat, so the kids learn how to exercise. And so there's a lot of things that need to change in our society. So I developed, this is our new healthcare model. This is the future of healthcare, which is the title of my talk. What can we do as a society to slowly make little changes in healthcare such that in the next 5 years we have super healthy people, like Minnesota, the healthiest state, we can continue to create healthy changes. So what we look at, if you look at, so for example, I'm immersed in orthopedics every day. I don't do any more primary care, although I educate and counsel on nutrition and fitness all the time. But I'm in the orthopedic world. What I'm trying to do is help people with chronic pain, injury, arthritis to get better and to thrive, survive, and have a fun, happy life again. So I deal with chronic pain every day. If you look at the traditional kind of orthopedic model, if you look at evidence-based medicine, which is what we're all trying to follow, there's not a lot of good evidence for the stuff on the top. So say I've got a bad knee arthritis, right? I go to the doctor, let's get you some anti-inflammatories. I'll go through some research on NSAIDs. That's not working, well, let's give you some narcotics. We really gotta get you sleeping, and okay, narcotics are addictive, a lot of problems with that. Well, that's not working, let's try a cortisone shot in your joint. There's no evidence cortisone does anything positive for your joints. It actually causes destruction to the joint. I'll show you some studies on that. That's not working, they do a meniscal surgery. They take out the meniscus. All the studies now from Europe and the United States show that meniscal surgeries actually cause more arthritis, and at the end of the year are no better than placebo. But it's $4 billion a year that you guys are paying for things that don't have great outcomes based on the research. So look at some other options. Basic things like nutrition. There's a lot of science on weight loss and arthritis and back pain and knee pain. Supplementation, there's some natural things you can do that don't cost any money that can help. Like glucosamine chondroitin has a lot of studies that it's very helpful. Things like movement, physical therapy is very helpful. And there's some other things we're gonna get into that are a little more cutting edge, like PRP and stem cell type procedures that actually have good evidence behind them showing they help joints regenerate as opposed to cortisone that causes degeneration. So if we're gonna change healthcare, the first thing we have to understand is why are our bodies breaking down? So this is gonna kind of blend a little bit into fitness, movement, nutrition. And we have to understand the bodies to understand why it breaks down. So if you think about our bodies, there's certain things that kind of influence it, and there's things that we can control, and there's things we can't control. For example, you guys were totally in control when you came into here. You made the mindset decision to come to this talk. So you were in control of making that decision. You also had the decision when you went to the, I can't see anybody by the way, everything's blinding with these lights, so I can't tell what you're eating by the way. But when you went in there, you had to, everybody made little decisions. Do you get the juice or do you get the water? Do you get this or that? So we have decisions every day on what we eat, on what we drink, how much we sleep. We can control all that. Certain things we can't control would be if I'm talking and all of a sudden I fall off the platform and I sprain my ankle. I can't control trauma, I can't control car accidents. You know, genetics is interesting. Some genetics things we can control. We can have influence on our genetics. It's called epigenetics, which means what we eat, if we sleep enough, if we're well hydrated, if we relax, if we pray, if we meditate, it changes what genes are expressed in our body. So we can control genetics nowadays. It's pretty interesting. People always say, nope, I've got the gene, I can't change that. You actually have 90% control of your genes. You can change what's expressed. So it's pretty cool. So we have control over our genes as well. But we're in a fight, all of us are that are in the healthcare model. You guys are kind of fighting on one end, I'm on the other end trying to make my patients healthier, but it's tough. We're fighting with opioid addictions, we're fighting society with poor nutrition, we're fighting with the TV, all the marketing ads for all the sugar and the junk that's out there, so it's really tough. When we look at, say, for example, opioid prescriptions, we know that it's a big problem. When we look at general prescriptions in general, we're talking at this point, we're paying $412 billion a year for prescriptive medications. And I'm not against medications at all. You know, we need medications, but at the same time, when you look at the medications prescribed, 7 of the top 10 medications are prescribed for lifestyle problems related to obesity, overweight, hypertension, cholesterol issues, and things like that. The other thing we're seeing is that obesity is on the rise in the United States. So it's trending towards, just at 2020, which is a year away, almost 40% of our adult population is going to be considered obese. Now, obese is not a negative term, it's just a medical term that categorizes someone's risk for chronic disease, death, heart attack, and stroke. What's really sad, if you look at that same trend, our kids, they're following that same trend as well. Our kids who, you know, are modeling their parents are seeing that same rise in disease. What's super sad with our kids as well is kids now in their teens are having strokes and heart attacks. Those are lifestyle related issues related to how they're eating. If their parents aren't teaching them how to do that, it's a problem. Another problem with kids is we're seeing that kids are dying younger than their parents. That means if their parents' life expectancy was 72, the kids are now dying 2 years younger than their parents should be dying because of what's happening with their nutrition, what's happening with their lifestyles, what's happening at school. So there's a lot of things we need to do to make some changes here. It's important to realize that because extra body weight converts into disease. So if you look at all the studies, extra body weight's associated with heart attack, stroke, diabetes, hospitalization risk, cancer, osteoarthritis of your knees, low back pain. So everything, you know, is related to lifestyle choices. So we have to make some changes there. There's also some risk factors for arthritis. If you looked at, okay, I'm just a general person, what are my risk factors for developing arthritis? This is interesting if there's any women in the crowd that are close to the menopausal years. Once you get through menopause, your risk of arthritis goes up because you've lost your hormonal support. Your estrogens, progesterones, and testosterones protect your body. So menopause is a risk factor for arthritis. Low hormone levels, nutrition, having extra body weight, all those things are going to influence what happens with our joints. Now we're finding even things that we eat, like anti-inflammatory medications like NSAIDs, actually increase your risk of joint problems, and cortisone shots are all risk factors for arthritis. I talked about the top 10 medications out there. Opioids, of course, we all know a lot about the opioids. I mean, we all loved Prince. We all love, you know, all of our icons that are dying from drug overdoses. What's sad for the general population is that opioid and medication overdose just passed motor vehicle accidents as the #1 cause of accidental death. So you think how crazy that is. It's the number one cause of accidental death is related to things that us doctors are trying to do to make people feel better. So it's wrong, and even the FDA is saying we need to focus on other ways to treat pain besides just, medications. So it's really a global problem, and it's very expensive. When you look at just taking NSAIDs, I won't even ask who took a Tylenol or, an ibuprofen or a Aleve today, but they're finding no matter what dose of NSAID you take, it increases the risk of stroke and heart attack. That's a new warning with all the NSAIDs, ibuprofens. Another study showed that people that take chronic anti-inflammatories for pain, like Aleve, naproxen, have a 2 times increased risk of a joint replacement. And that's because NSAIDs, they block inflammation, right? But inflammation's not always bad. Inflammation is the body trying to heal something. When you sprain your ankle, it gets inflamed and it puffs up and it's all swollen. That's the body sending healing cells trying to heal that. If you take NSAIDs on top of an acute injury, decreases the healing of the soft tissue as well. So we're trying to avoid those as well. Now, cortisone is another super interesting thing. I mean, anybody that comes to see me has probably had 10 cortisone shots in the knees. They're getting spinal epidurals with high-dose cortisone. What this study shows, and this is really important, that any cortisone shot at a certain dose at a higher level, which is your standard orthopedic cortisone shot to the joint, the knee, the spine, is going to be chondrotoxic. That means it's toxic to those cartilage cells. And that's important because cartilage is what you want. Loss of cartilage is arthritis. That's degeneration. So we don't want to put cortisone in joints because it kills cells. Another interesting thing about the study, when you tease out the study, they found even the lidocaine that's mixed with the cortisone is chondrotoxic. So in my practice now, instead of using lidocaine, we use ropivacaine. It doesn't kill cartilage. So there's a lot of little subtle things you can do. And even with the cortisone, there's a certain dose that you wean it down to that actually is not chondrotoxic. So we've got to look at doses as well. This is a study on epidural steroids in the spine. 6,000 patients were in this study. 3,000 had cortisone, 3,000 didn't. Those that had cortisone epidurals, which is very common, everybody gets them every day, they had a 1/3 increased risk of a spinal fracture because it causes localized breakdown, osteoporosis, and loss of the structure there. So again, we're trying to avoid things that are negative. Let's start focusing on things that can help heal and regenerate the body. Steroids in the tendons cause more breakdown, more problems, so we're avoiding it in tendons as well. Surgery, I just sent 2 or 3 patients to surgery yesterday. It's definitely needed, and I'm not at all against surgery, but I'm also trying to balance out our cost and what we do. Surgery is super expensive. If you look at spine surgery, $50,000 for that spinal fusion, okay, the person just spent 3 times, it's a lot of money compared to what you're charging for their insurance premiums. One spine surgery and they burned it all up, and then everybody else has to pay for that person's spine surgery. The problem with spine surgery too is if it's not done for the right indications, it has a high failure rate as well. We talked a little bit about knee surgery, meniscal surgery, again, a $4 billion surgery, which there's no evidence showing it helps. The problem with meniscal surgery is 100% increased risk of arthritis once you've taken out that meniscus or had it clipped down. So then you come in 3 years later, now you've lost the cartilage, you're starting to limp because you're getting more arthritis in that joint. Total joint replacements, again, I send patients for surgery all the time, but only if other more conservative, less expensive things fail. Problem with hip replacements, joint replacements, knee replacements. For example, knee replacements at 5 years, about half the people have their pain back, with about 15% have more pain back. There's also problems about 1/3 of joint replacements. When you do them, the problem is it's not fixing the problem because they miss the source of the pain. So you replace the hip, but the pain was coming from the back. You replace the knee, but the pain was coming from a pinched nerve in their thigh. So that just goes to the clinician that we have to be very good diagnosticians and make sure we make the right diagnosis before we do things that could be harmful. So when it comes down to this, all of us are involved in healthcare. We are in a healthcare crisis. We have an election year coming up, and I tell you what, there's gonna be a huge debate on what's the best thing for healthcare. What the debate should be on is what can we do to make our population healthy? How we pay for it, that's up to you guys. How we make our population healthy, that's up to all of us. We need to create healthy populations, and that's gonna decrease the risk of health or the cost of healthcare, but it's gonna make a healthier, more vibrant population as well. So the big question is, how do we do that? How do we create a more healthy, environment? And we need to start decreasing things that are destructive, they aren't good, increasing the things that are helpful. And that's what we're gonna talk about here, is how do we take that pendulum? Because your body wants to regenerate, right? My book is entitled Regenerate, Body Heal Thyself. And your body, you cut your arm, you don't have a gash for the next 10 years, your body heals it back up. When I fell off my stage 5 minutes ago, 6 months later, or 6 weeks later, I'm walking again because my body repaired those ligaments and those tendons. So the body has the ability to repair itself, it has the ability to heal, has the ability to reverse diabetes, it has the ability to get rid of cholesterol problems. We can do that with lifestyle changes. So we're gonna go into that a little bit. So the model that I put together for that is called the C.F.A.N model. And what it stands for, the C is cell health. That is the cornerstone for all healing. I'm gonna spend a lot of time talking about cell health. The F is for functional movement. Can you do a simple lunge? Can you do a simple plank? Can you hold your body up in the right posture that prevents degeneration to the spine and to the knees? So really simple things. The A stands for articulation. That's why people fly into St. Cloud, Minnesota from all over the place to see me, because their joints hurt, because there's things we can do that are fascinating to help with their joint problems. The N is for nerves. So if you had no nerves, you'd have no pain. So when we talk about people that are in pain and have problems that are breaking down, if we don't address the nerves, we're missing part of the problem here. There's some new evidence and things we can do with nerves too to make them better. But let's talk about cell health. That's what you guys are here for. You're here to learn how can I become healthier. So to me, cell health is what's happening on the inside of our bodies, what's happening with our metabolism, what's happening with our antioxidant levels, what kind of nutrition are we taking, are we exercising, are we moving? It all affects our cell health. When you have healthy cell health, your body can heal itself. So the goals when it comes to cell health is, first, we gotta change our mindset. If we have a negative mindset, if we think we can't do it, if we're stressed out, we're never gonna get anything done. So we've gotta change this first. Then it comes to things like fitness and getting your body moving again. It comes to making little subtle changes in how we eat and our nutrition. Eventually we're gonna talk about things you can do from sleep, hydration, all these different things add up to create a healthy cell. When you have a healthy cell, it creates a healthy organ. Healthy organs create healthy people. So we coined this thing called the 6 core elements of health. And this is what I think every healthcare system should have, is your 6 core elements of health. And we've actually digitized this into all of my patients get this digitally. When they come in, we give them a little website, they log into it, and they get this whole program on how to get a healthy mindset, how to meditate, how to clear out their stress, how do they breathe, how do you eat, how do you sleep. It sounds real simple and basic, but I guarantee each one of you guys, if you implemented these 6 elements into your lifestyle, you would consume less healthcare dollars, you would enjoy life much better, you'd be more vibrant, you'd have more energy to play with your kids or walk with your grandkids. It's really basic stuff, but the oncologists should use this, the OB-GYNs need to use this, the sports medicine guys, the orthopedics. This is basic healthcare stuff. When we talk about the first core element, which is thinking or your mindset, I wrote another book and it's almost done. It's called Becoming Superman or Becoming Wonder Woman, right? It's how can we become the best version of ourselves you can possibly be. That book goes into my brokenness as a little kid, when I hated myself, when I thought I was da-da-da-da-da. That's not me. That's not what I was created for. God didn't create me to be an insecure little kid growing up in an insecure adult. He created me for a purpose and to do amazing things. And we have to work through our kryptonite. Our kryptonite is the stuff that plagues us. It's our addictions. It's how we view ourselves in the mirror. It's our relationships with toxic friends. We have to take all that kryptonite and convert that into our superpower. So that book just goes into how do we change our minds so we can change our families, so we can change our communities and live a healthy life. The next part of the element is breathing. Breathing seems so elemental. I'm breathing right now. But there's different ways that we can breathe, and there's a lot of science and research behind breathing. So what I'm gonna do now is I'm gonna teach you guys how to do diaphragmatic breathing. Does anybody know how to do diaphragmatic breathing? Is anybody a singer or performer, an opera singer out there? Anybody had vocal training? You learn to breathe with your stomach. So most of us breathe with our chest. We go, it's a very anxious, shallow breathing. Diaphragmatic breathing is breathing from your diaphragm. You push your diaphragm to watch my belly. My chest stays here, my belly goes down, my diaphragm is going down. It's allowing my lungs to expand, but we need breathing for a few reasons. It delivers oxygen to our tissue, which helps us regenerate. It also helps us relax. So I'm gonna teach you what's called square breathing. If you have kids that are real anxious and uptight, teach them how to do what's called B breathing. So you do the same thing I'm gonna do, but you just add a bzzz, add it in your exhale. The buzzing slows down your breath, but a square breathing is you do 6 seconds. This will be your inhalation, you guys. This will be you hold it for 6 seconds. This is where you buzz for 6 seconds. Then you hold at the bottom for 6 seconds. It's square breathing, and you guys all drive to work. We all commute. I square breathe on the way to work. I'm like sitting there buzzing, bzz, holding my breath. But it actually takes your anxiety level down, it de-stresses you. That all is physiology as well. It decreases my cortisol levels, it helps me relax. It's an anti-inflammatory, it gets your mind set. It's just a really good way to breathe. So let's do some square breathing. So inhale, hold, bzzz, hold. Got it? For 6 seconds each. Ready? 1, 2, we're gonna inhale. Hold it. 3, 4, 5. We're gonna be it. Empty it. Hold. Breathe with your diaphragm. Inhale. Belly should be going out. Push away from the table. Hold it. B. So you can see what it is. Kids like it because they make buzzing sounds, but it actually has a very physiological effect on kids that are hyperactive. When your kids are stressed out and they're anxious, they're playing way too much Fortnite, right? That is a crazy, stressful game. My son is amped all the time. Teddy, breathe, relax. You gotta teach them how to just get rid of that junk. If not, it's always in there. They're always all amped up. So breathing's so important. Next thing is we're in the cafeteria. We have to talk about nutrition. I'm gonna just talk about it briefly here because I've got a lot more to go through on nutrition coming up. But it is the cornerstone for all of healing. Hydration is super important. You guys should be drinking about half your body weight. Way to sip that water. There's half your body weight should be done per day, half your body weight in ounces per day, which ends up to be a lot of water. If you're active, it's a hot, humid day, you're walking a lot, you gotta amp that up. So hydration is important. We're mostly water. Our cells are mostly water. We're talking about cell health. Hydration is super important, critical for weight loss. If you're on a weight loss plateau, push the water. You might just break your plateau right there. I'm all about trying to get people to heal, regenerate, and have a healthier body. If you don't sleep for 7 to 8 hours at night, your body doesn't heal. And your brain has to heal as well, right? You guys are working in a high stressful environment. You're doing a lot of stuff. You've got deadlines. You've got things to get done. Your body only heals while you're sleeping or while you're meditating. So you need to sleep 7 to 8 hours a night. When I talk to my patients that are injured or they're in pain, I'm trying to heal them. If they're only sleeping 5 hours a night, I can only do so much for them. They've got to learn to sleep. Sleep is a huge topic, talking about your sleep environment, talking about lights and if they're too bright at night. There's a lot of things you can do to sleep better. If you're a poor sleeper, research some of that stuff because it's so important for your longevity. Another way to break your weight loss plateaus is for sleeping for 8 hours. A lot of people, I just can't lose my weight. They start sleeping better and their weight starts coming off. It's super important. The final kind of element is movement. So movement is something that it doesn't have to be like crazy. People get intimidated by fitness, and I talk about fitness all the time. It's not like boot camp style, crazy, CrossFit, sweating, just getting nuts. Movement is going for a walk in your beautiful little corridor for 15 minutes at lunch. That is movement, and that's gonna decrease your insulin levels. It's gonna help you relax your brain. It's gonna burn calories, but it's also gonna increase your metabolism. So movement doesn't have to be crazy. It has to be just movement. It can be going fishing. So casting, standing up, core movement, that's actually considered exercise. Just like going for a walk, playing light tennis, anything like that is all movement. So start little. The big thing with you guys that have families is start moving with your kids. Hey, it's middle of June, it doesn't get dark till 10. We've got plenty of time after work to go for a walk with our kids, take them to the park, and just move with your kids. Throw the ball around, kick it, who cares, just have fun and make it a creative, fun time of movement. So I love this. So every year at Rejuv, we have kind of our annual, we used to call it Biggest Loser, but we can't call it that because it's already taken. So we call it a Life Transformation Challenge. It's a 3-month challenge that all of my employees go through. And you guys should do it. You guys should do employee challenges. You probably already do that. But it also is open to our community. So we usually have about 50 to 100 community members come through, do this 3-month transformation. But I love this. This was our first one. So Jen came in. Jen had hypertension. She had high cholesterol. She was on medication. She was a smoker. What I love about this picture is Jen had a little baby. She had a kid who she was responsible for. So Jen came through our program. Of course, we talk about lifestyle changes and all the stuff and got her moving, eating healthier. And so Jen lost, 65 pounds. She lost 1/4 of her body weight. She lost a ton of inches. And so she did good. She won our competition. So she's super happy. She was off her medication. She had quit smoking. Good stuff, but she wasn't done because we changed her mindset. Jen was like, I'm not stopping. It's 3 months. She continued on her journey. So then about 3 or 4 months later, there was a scream that came out of the gym, and I thought Jen had broke her ankle. So we go over there, check it out, and Jen was just standing on the scale, and she had broke the 100-pound mark, right? So Jen was screaming because she was so excited that she changed her life. And I ran into Jen, last week, and she still looks good. She's still healthy. She's still motivated. But what's awesome about this picture is that now little baby, who's probably now 5 or 6, is walking with mom and going to the grocery store and learning about vegetables. And so it's just a good story of life transformation. But the thing, okay, let's look at healthcare costs, right? This is a healthcare talk. So Jen's no longer on her cholesterol medications, no longer on her hypertension medications. She's not going to the ER because she's fatigued. She's not smoking. So we've probably saved the healthcare dollars in her next 20 years, $100,000 probably off what you guys are paying for, because Jen made some simple decisions to change her life. But now she's super happy too, which is bonus. Look at exercise. It benefits everything from cancer to diabetes to stress to body fat. Movement is super important. So something we should all remember. If you have bad knees, this study just shows that weight loss over a 2-year period caused decreased problems with the joints, better joint function. This person could run more, these people could run more in that study as well. I want to talk a little bit about nutrition, because this is really the cornerstone for all of this. Nutrition is 90% of health. Movement's important, sleep's important, everything else is super important, but what we put in our mouth, including what we drink, is just super important. Hippocrates said, let food be your medicine and medicine be your food. So there's a lot of healing power in food. It's pretty cool. But when it comes to any healthcare subspecialty or specialty, it should be the first line talk that we have with our patients. It should really be the cornerstone for it. What's super interesting about nutrition is that it affects our genes. So how we eat changes what's expressed in our genes. So if I eat super healthy, tons of crappy fats, tons of burnt, high processed meats, my genes for cancer get turned on, and there's a good chance I'm gonna get colon cancer. If I'm eating a ton of fruits and vegetables, eating 2 or 3 vegetarian meals a week, still eating meats, during the week, but I'm eating tons of antioxidants, my gene for cancer gets suppressed. It doesn't get expressed, and I don't get colon cancer, just from some simple changes that I've made. And so maybe you have a sibling or a brother, mother, father who has had cancer. Same thing with breast cancer, by the way, for the women. It is affected by the way we eat. So if you're like, man, my mom's had cancer, you better start dialing some stuff in, do some research on eating for breast cancer, because there's things you can do, more vegetables, less processed foods, no salami, no hot dogs, definitely related to cancer for breast and prostate and colon for men and women. It's on the American Cancer Society's website, so don't do any processed meats. But anyways, it is the cornerstone. What's interesting, sad, and exciting is how we eat. If you're of childbearing age, whether you're male or female and you decide to have children, how I eat changes my genes. That goes into my sperm or your egg, and it's going to change your kid's genetic expression as well. So how we eat in our younger years changes what genes are turned on, and babies come from genetics coming together and creating something. So you change, it's called transgenerational epigenetics. So how we eat changes the generation behind us as well. So dang it, how did we get here, right? It comes from our sad diet. Our standard American diet is not really healthy nowadays. If you look at the amount of sugar we consume, throw some numbers out there. How many pounds of sugar a year do you think the average American consumes? 70? It's higher. It's 160 pounds of sugar a year the average American consumes. How many pounds of processed white flour do we consume a year? 200 pounds of processed flour and grains the average American consumes. About 400 to 500 calories are coming from soda for the average American. If you're a teenager, it's almost sometimes close to 1,000 calories coming from sodas. So it's really changing our culture. It's too easy, it's too convenient. The other thing, if I read labels all the time, vegetable oils, it sounds cool because it has the word vegetable in there, but vegetable oils are not good for us. There are other types of fats that are amazing for us, and I'll talk about some of the good fats as well, but anything that says vegetable on there, don't eat it. It's got a lot of hexane in there and other things that don't promote health at all. So, but oils and good fats are good for us. We talked about sugar a little bit, not good. Nutrition should really be a way of life. So how we eat is super important, but it has to become a habit, not a diet. There's a lot of different ways that we can eat. In our clinic, we offer variety. There's not one pattern that's best for anybody, and just kind of coolness. Is anybody doing any certain meal plan, like we'll say paleo? Any paleos out there? Anybody doing a keto diet or a ketogenic diet? So it's probably the most popular lifestyle. I don't even like to call it a diet, but anybody doing intermittent fasting as kind of a way to do it? Yep. So I'm intermittent fasting too. Is anybody just doing clean eating, just trying to eat cleaner and doing more organic type stuff? So there's so many options out there. Is there anybody doing vegetables, vegetarian, vegan, or variety of? Yep, so there's a lot of good options out there, and I've done all of them. And my book actually goes into vegetarian lifestyle, intermittent fasting, keto. What's interesting when it comes to carbohydrates is we all need to at some point be in ketosis. That means if we're going to lose weight at some point, you have to burn body fat. And that's what you hear a lot of people talk, hey, I'm keto. It kind of sounds cool, and you wear cool glasses and you have an Apple computer, I'm keto. But Keto, you have to go at some point keto to burn fat. So all it is sliding down your carbohydrate numbers. And so I kind of put it into kind of 3 different levels. Foundational nutrition is about 100 to 150 grams of carbohydrates a day. You're gonna maintain your body weight, but you're not gonna lose weight at that many. And that's, for example, the average American consumes 150 to 200 carbohydrates a day. So if you maintain that, you're gonna gain a pound a year. If you want to get to what I would call kind of accelerated nutrition to lose about a pound a week, you've got to get your number of carbohydrates less than 100 grams a day. If you want to go accelerated, I call accelerated weight loss keto, that's the ketogenic diet, you have to get less than 50 grams of carbs a day. So keto's not bad, it's not good, it's not one thing or the other, but sliding your carbs down is super important. When I say carbs, I'm talking sugar, processed stuff, grains, and the stuff that doesn't do anything. Good carbohydrates would be your entire plethora of vegetables and certain fruits. Certain fruits are very high glycemically and will spike insulin and will cause fat storage. So just keep that in mind. Intermittent fasting, general nutrition guidelines is stuff we've kind of gone over already, is just keep your sugars low, hydrate a ton. One other one I want to highlight here is the frequency of eating. So when I first started, I used to preach, hey, you got to be eating all the time, keep your metabolism going, you make sure you're snacking, make sure you have a breakfast and a meal before dinner. I was preaching 6 meals a day. All the recent research is saying, no, you don't have to eat 6 times a day. You can eat once or twice a day if you want to. You can fast. For those that fast, I usually fast till about 12 or 1 during the day. I'll eat from about 1 till 7 at night. It does not slow down your metabolism. It sensitizes your insulin. It does a lot of other positive things for you when you fast. But you don't have to eat frequently. So if you're not hungry, don't eat. There's the big guidelines there. The other thing when it comes to cell health is looking at what's happening with our hormones. I have a lot of women and men who just can't break their weight loss plateaus. They're feeling lousy. Sometimes you have to do some lab workup and look at their endocrine system and say, hey, what's happening with your thyroid? Thyroid is related to almost every cell in our body, from joints to causing fatigue, to your nails, to your hair, to weight loss, to everything. So looking at thyroid is important. I look at a lot of cortisol levels on people because my patients are all chronic pain. A lot of my patients are apathetic. They have no energy. Cortisol is a hormone made by the adrenal glands, and it's there to suppress our pain, suppress our inflammation. So if they're not making cortisol, a lot of my patients look like this. They have like a flat line cortisol level, which is the black line on the bottom. They have no energy, but they also have a ton of pain because cortisol naturally suppresses their pain. Often people that are causing, if they're apathetic, they have no energy, they can't lose weight, we'll look at their sex hormones. We'll look at their estrogen, progesterone, testosterone levels, the DHEA. If those things are out of balance, sometimes you have to correct those as well to get that vitality and that life back again. And also for me, help them to heal better as well. So hormones are super important. Vitamin D, I think there's some more snow melting out there right now. We're just coming off of winter. We don't get a lot of sunshine in Minnesota. So getting some vitamin D supplementation is very simple and easy, but it can actually help with energy, weight loss. They did a study in high school athletes. Those that supplemented vitamin D had a 20% increase in their strength. So it's needed for all of our functions. But when you put this together, cell health makes people super happy, but it really helps out to squish chronic disease. All these basic things I talked about, it's not easy to implement. That's why it starts with mindset, but it's very important. So I'll kind of cruise to the next, that's cell health, the basic. The next is F for functional movement. Functional movement is pretty basic. It's like how strong are you, how flexible are you, what's happening with your fascia and your connective tissue. Those things are all very important. You have to have a baseline stability, baseline strength for your body to function. Things that we promote for healthy functional movement is exercise, fitness. Sometimes we send you to a physical therapist. Looking at your fascia, doing some foam rolling, actually has some studies on healing and helping there as well. Sometimes you'll see the chiropractor get the manipulation, or a massage therapist get things back into alignment. Often if they have really bad arthritis, we'll use bracing to unload areas of degeneration. That tends to help as well. So the F, functional movement, pretty straightforward. The A is the articulation. So articulation is pretty interesting. Articulation is the joint. So it could be the spine, it could be the knee, and that's why most patients come to see me, is because I do a lot with the joint, with the spine. I talk about cell health because it makes the joints better. People come to see me because they want their knees to feel better. If I don't address their cell health and all the unhealthy things, they're not going to get better. So that's why all this is so important to me. So articulation is what's happening in the joint. Why do joints break down? Well, genetics is a part of that. Sometimes you inherit a gene where you have bad connective tissue and you tend to break down more. Also dysfunctional movement. So for example, if I'm a high school football player, I'm cutting, I pivot, someone tackles me, and I sprain my MCL. Ah, it hurts. It kind of hurts for about 2 weeks or so, but I'm a young athlete. I'm playing in 2 weeks. What's happened is I've created some micro instability in my joint. Then over time, what's happening is that joint, because there's micro instability of that MCL, they come and see me and they're 30 years old, but they've got a degenerated knee. Because over the years, that MCL sprain 10 years ago has now caused arthritis. So we need to do things with instability. What about the spine? The spine's the same thing. The spine is a big stack of blocks. The blocks is held together by a bunch of ligaments. It's like saran wrap that holds it all together. But if I'm driving down the road, again, a car accident, I just sprained my neck, I sprained my low back. Those ligaments are unstable. 3 years later, I've got chronic low back pain. My discs are starting to slip out. I've got pain going down my leg because that car accident, even though it didn't hurt too much for the first 2 or 3 months, just kind of achy, a little stiff, over time though, that back accelerates in its degeneration, you get more arthritis and problems. So we do need to work with instability and do things that can kind of reverse that degeneration, tighten up those ligaments, help those joints heal better. So we'll talk a bit about that as well. So people come to see me for a lot of these things. I don't know if has anybody heard of prolotherapy? It's been around forever. Anybody heard of PRP or platelet-rich plasma? Rafael Nadal, a lot of professional athletes get PRP. Has anybody heard of stem cell treatments, like stem cells to the joint or the hip, the back? So stem cells is becoming more popular for like large joints. PRP, we use that a lot for like tendon injuries and carpal tunnel, tennis elbow, those types of things. So what is prolotherapy? Prolotherapy is the proliferation of a ligament or a joint through the stimulation. Prolotherapy is trying to get those things to tighten back up again. So we talked about how the body has the ability to heal itself, right? If it gets stretched out, the body sends cells to repair it. Prolotherapy tries to mimic the body's healing response by giving a slight irritant to a ligament or a tendon and getting the body to go back and realize that's an injury and repair it. PRP. So PRP is basically platelet-rich plasma. It comes from a simple blood draw. You draw the blood, you separate out the platelets, you inject those healing cells back in, which causes the body to heal and repair. And then the third kid on the block is a stem cell procedure. It usually comes from bone marrow. Bone marrow, you can get the stem cells out, separate those out, put those back into a ligament, tendon, rotator cuff tear, and it causes the body to repair. It just takes those body's healing cells from one part, puts them into the part that's degenerating, aging, and gets the body to heal and repair. So stem cells work from a few different ways. It basically causes the body to heal itself by stimulating the mitochondria to have more energy. It actually does the stem cell transfers its mitochondria, which is a powerhouse, into the cell of the degenerating cell. It controls the inflammation in there, tells all these abnormal inflammatory areas to start not being so destructive, so it calms down the destructive inflammation of the arthritis. The other thing it does, it goes into the environment and it tells the area, hey, this place is injured, so it signals the body to come in there and start helping with the healing. So evidence for these things, there's a lot of level 1 evidence for prolotherapy. That's the first thing we talked about. It's actually an injection of a dextrose-based solution, which is a simple sugar compound. Has no destructive effects, but what it does, it goes in there, irritates the area a little bit. The body senses the irritation and sends its own healing cells to it. So there's a lot of level 1 evidence that shows it works well. Prolotherapy. PRP is the next kid on the block. There's a lot of studies on PRP, how it works. There's even good studies on osteoarthritis, which is the one thing that we never thought we could help with injectables, but arthritis is looking like there's some good studies for that. Stem cells is kind of the newest kid on the block, and again, these are stem cells from your own body. These aren't placental or embryonic. These are your own stem cells from your bone marrow. Good evidence that they heal well. They're showing studies that show increased cartilage growth, increased cartilage quality, decreased pain scores, so a lot of good things happening there with the stem cells. For time, I'm gonna try to get through this so we can have some time for questions. These here are just looking at different types of stem cells, and what the studies are showing with the different types of stem cells, this kind of sums it up, is that stem cells from bone marrow tend to be more superior from stem cells from adipose, placental, or other areas. So in orthopedics in general, we're trying to trend more towards using bone marrow-derived stem cells when it comes to osteoarthritis, especially of the knees and larger joints. Much higher safety profile with a bone marrow harvest compared to a lipoaspiration or a liposuction. The final thing we'll talk about is the nerves. Now, nerves are super interesting, and we treat nerves every day, but we're finding that nerves are a source of pain. if we don't go and address the nerves, the body's going to be in pain. So it's interesting, there was an anatomist back in the 1800s, and he used to dissect people, right? He'd follow these nerves all over the place, but he found that every nerve going past a joint would send a branch of that nerve into the joint. So if I've got a pinched nerve in my neck, it's going to go past my joint and can cause shoulder pain. If I've got a bad nerve pinched in my spine, it could cause hip or knee pain. So we've got to look at nerves as a source of impingement when it comes to trying to figure out people's pain patterns and what's actually causing their pain. So these are just some diagrams showing, hey, look at the shoulder. There's about 2 or 3 different nerves that if they're impinged, they're going to make you think you have shoulder problems in your joint. Same thing with the hip. We do a lot of patients with joint replacements, but they're still having hip pain. It's because the femoral nerve in front of the hip is pinched. You free that nerve up where it's getting pinched in this muscle, and their hip replacement pain goes away. So we have to look at these nerves. It's super fascinating. This here shows there's about, if anybody have carpal tunnel, I've had it before, it's a tough one, and you can't do anything and everything zings. But that's one tunnel syndrome. There's 30 different tunnel syndromes in our body where nerves can get pinched. And the reason for that is, we're very flexible, we're doing stuff, we're doing back bends, we're doing whatever, and every time your joint moves, that nerve has to floss and go around that joint. So anytime there's a joint or movement, the nerves go through muscles, go through osseous, bony structures and tunnels, and they can get pinched. So there's a lot of things we need to do with nerves to try to get them better. What's pretty interesting is we're finding if a nerve is compressed for too long, there's a little blood vessel that supplies blood to that nerve. The nerve starts to fire, it starts to get irritated. There's a little receptor, and that receptor starts to kick out 2 little substances. One's called CGRP, and one's called substance P. So super sciencey, maybe not that interesting, but what it's interesting for me and people in chronic pain is if we can block CGRP and substance P, we can make people feel better and stop the destructive problems that are happening from nerve impingement. So when nerves are pinched, CGRP causes neovascularization. It causes collagenylysis. Collagenylysis is breakdown of collagen. So when nerves are pinched, it releases this CGRP chemical. It's almost like maybe you could call it like an acid or irritant, but it eats away tendons, eats away joints. So you can't have a pinched nerve when you're trying to get a joint better because that nerve is going to have a bad influence on that joint. So the goal with these things is to get in there and to release these nerves where they're pinched. A good study from Mayo a few months ago showed going in and releasing the nerve in the carpal tunnel with a simple injection actually helped to relieve the carpal tunnel pain because all you do is you go in. It's actually more of a small procedure. You go in, you can see on the top, the nerve is that round little, I don't know if I can point on here, but you see that little nerve right there? So that nerve is being freed up by a needle. The needle is basically going, I'm dissecting the fascia, the connective tissue away from that carpal tunnel nerve, and it's freeing up that nerve so the nerve can then floss through the tunnel without getting stuck. But we can do this all over the body with small little needles and free up these nerves to help with the pain. We talked again about steroids in the spine. Well, oh man, I can't do steroids in the spine anymore. Good news is, another study just came out in 2016, then another study recreated in 2018 showing that we can put dextrose, which is a very safe sugar, at a 5% concentration into the spinal column, has no negative side effects like the cortisone has, there's no spinal fracture, but decreases pain for longer and better than a steroid shot. So actually all the steroid epidurals, all the epidurals I do are non-steroid based, they're just dextrose based ones, much safer. And what's cool about that is it's a lot cheaper to do, and it's going to save healthcare dollars, but it's going to have less negative side effects on that person in the future as well. So really when it comes to sum things up, the future of healthcare is kind of combining a few things together. We have to be innovative, right? We have to look at research, where's science going? I mean, it's kind of interesting. We all have cell phones, we've got crazy technology, we've got all this stuff going on. What's advancing technology-wise is also advancing in the medicine side as well. There's tons of research on all the stuff that we talked about today that shows healthcare can be done differently and we can create true health in our patients, but we do have to be innovative. We have to be very integrative. That means we have to take the cell health, the functional movement, the articulation, the nerves. When you put that recipe together, it creates a successful healthcare model that for you guys is going to decrease how much you have to pay for these things, but for the consumers is awesome. It creates a healthier population and healthier life for all of us. So that is really it. And so this is my awesome family. The tall blonde guy is actually flying back to Poland today. He was my exchange student for the year. I kind of said goodbye to him this morning. Like I said, I'm sensitive. I was like teary-eyed driving to work today because Peter's gone. But Peter is at the airport right now flying back to Poland, but the other ones are mine. And so this is my big passion for life. But I think, Rosamond, do we have a couple time for questions?
Yes, we do.
Okay, so we're open for questions, and we probably have 15 minutes or whatever. I'm not sure how long you guys have. Any questions? So the question was, do we have difficulty getting insurances to pay for stem cells? So it's in Minnesota right now, there's probably about 4 insurance companies that pay for it. So a lot of the self-insured, so Minnesota Railroad Union pays for it. Hy-Vee grocery store chain pays for it, which is in this area as well. Good Samaritan's Christian Insurance, which is kind of a group insurance type thing. And there's a lot, so basically it's starting right now with the self-insureds, and the reason that it's starting with the self-insureds is because if I have 500 employees, they are responsible for all their healthcare costs. And so what they're finding is they're saving about 84% of their healthcare dollars by covering stem cells. So a lot of these, for example, if you came to me with a bad joint, they'd require that you would do stem cells first and fail before they'll pay for that knee replacement, just because they're saving a lot of dollars that way. So, but it's relatively new. So, I mean, I'm sure the Blues are looking at it and all the other ones are as well, because you guys are always looking at costs versus effectiveness, and it's just that healthy balance that people have to look at.
Hi, thanks. Earlier when you were talking about nutritions, you said one of the things you can do is start researching nutritions that can help, that can just help the proper genes express themselves, just to help your fitness generally. Any particular recommendations for sources out there that are good nutritional sources?
Yeah, so my book's really good. It's on Amazon. Just kidding. But no, my book does go to a lot of nutrition. But if you have, say, chronic disease, inflammatory disorders, rheumatoid arthritis, anything that's kind of autoimmune, you should be on what's called an anti-inflammatory protocol. So if you just research anti-inflammatory protocol, it's going to teach you certain vegetables to avoid, certain foods to avoid, certain meats to avoid. It's going to talk about bringing in more fibers, more vegetables, and things like that. So anybody with autoimmune, I always recommend the anti-inflammatory protocol, which you can just Google. There'll be tons of information on that. If you're like, no, I just want to lose weight, I want to lose 30 pounds before the wedding, I don't think keto is a bad idea, actually. Now, keto can be very mistaken, though. So a lot of people think keto is a freedom to do as much fat as you want. And I told you I'd talk a little bit about fat, so maybe I'll use 5 minutes right here to talk about fat. So fat is super awesome. So fat is super important for a lot of reasons, but it has to be good fats, right? So it has to be fats, because fats in general are actually very anti-inflammatory. So when people come to me with a lot of pain, with nerve issues, I recommend certain fats in higher concentration. So I recommend a lot of omega-3 fats, which can come from fish, it can come from omega-3 supplementation, it can come from free-ranged eggs, for example. So if you do the free-ranged egg, it has a lot of omega-3s, because those chickens are eating omega-3s. If you're doing the grain-fed eggs, they have high omega-6s, which are very inflammatory. So you need to avoid the omega-6s, which come from a lot of your corn products. Talking about oils, so I don't even worry as much anymore about saturated versus unsaturated. I just look at the type of oil. So for example, if I'm eating a clean hamburger from a grass-fed animal, that's going to have a high ratio of omega-3s and better fats than a grain-fed animal, just because of the way they're getting their sources. So I eat a big hamburger, I enjoy it. I don't do hamburgers every day. I do some vegetable breaks here and there. And then your coconut oils and your avocado oils are super good for cooking, because you need a good cooking oil. Olive oil, you can't cook with it as well. It doesn't do good at high temperatures. But coconut and avocado are awesome for cooking, making salad dressings. Again, read your labels. When you start reading labels, every salad dressing on the market, except for a couple, are all vegetable oil based. And that includes soybean oil, vegetable oil, canola oil. They're all the same. And the way they're processed is at a super high heat. But when it does that, it kind of denatures a little bit and creates an unstable fat. You want really stable fats when you put it into your body, because stable fats, what's your brain made of? Fat. What's your kid's brain made of? Fat. What are our nerves coated with? Fat. You need very stable fats in our bodies because they protect us from inflammation. All of our kids, like my baby, she's 3. You saw her cute little picture up there. When my wife's not looking, because she doesn't like the way the thing smells, but I put a ton of omega-3 fats into her little bottles, because it's really good for her brain. It's going to help her develop. So if you have any little kids, higher scholarships with omega-3s, better concentration. So kids need omega-3s because it's good for their brain and suppressing inflammation. But a little side from your question, but any other questions? Yep.
We all know exercise is really good and important, and we have a lot of people who walk around here, which is awesome.
That's great.
I'm curious about your opinion of things that are much more severe, like CrossFit training.
Yep.
And is that good, or what your thoughts are?
Awesome question, right? So the question, do you guys all hear that? type of exercise is too extreme bad for you or good for you? And the answer to that is yes and no and no. So yes, too extreme exercise is not good for you if you just jump right into it. Certain people, when you work your way up to that type of fitness level, yeah, it can be healthy. All the studies do show, though, people that do chronic cardio, which would be like your marathon runners, your super high endurance athletes, they actually have a lot higher death rates. They have higher breakdown in their bodies. Their adrenal function, their cortisol level flatlines, because exercise is a stress. Just like your work is a stress. The stress is your brain. So if people are engaging in CrossFit activities or higher intensity activities, awesome, but then you need to give yourself a couple days of break from that high intensity. Then you need to walk, eat healthy, sleep good, and then do crazy once a week, twice a week high intensity, and then do walk, lower intensity. So high intensity can be good from certain areas, but some of these people are like, man, I'm just gonna go high intensity right off the bat. They find themselves fatigued. They find themselves craving sugar. They find they're getting back pain because their body's not ready for that. So the answer is yes, high intensity can be good, but in moderation and at the right time. The best thing to do is to start slow and slowly progress the stress to your body. Your body responds to stress and heals a little bit every time you exercise. So you gotta start slow and just keep adding a little bit more, adding more. Does that kind of make sense? So there's good and bad to that question. Yep.
Hi, I have a terrible sweet tooth and I've tried to curb the sugar down, but then I've also supplemented it with Equal or NutraSweet, which I'm finding I'm not losing weight. Could you explain why our body doesn't
lose weight on artificial sweeteners?
Correct.
Yep. So good question, and that's the big thing. Like, hey, I drink Diet Coke all the time, it has no calories, but people tell me Diet Coke makes me gain weight. So the problem with artificial sweeteners comes down to the fact that it is sweet. It makes your body think you're eating something sweet, and it still spikes your insulin. So when it comes to weight loss, the secret to weight loss is your insulin level. So insulin's awesome because it's a hormone that regulates our blood sugar. If our blood sugar gets too high, it's toxic, and that's why diabetics get all kinds of problems. But if your insulin chronically stays high, insulin is a storage hormone. So if my insulin goes up, no matter what I put in my mouth next, the body's gonna store that, because insulin's telling your body, put those carbohydrates into places. If your muscles get full and there's no more place to store your carbohydrate, it pushes it into fat. So it converts your carbohydrate into fat. So even if you're drinking a diet soda and then you have the apple because it's healthy, or you have that piece of fruit, your insulin level's already been spiked from your diet soda or the artificial sweetener. So your insulin's here. Then you give the body anything, it's gonna push it in as fat and store it. So there's a couple artificial sweeteners that you might be able to biohack a little bit with, and one of those is monk fruit. So monk fruit is a monk, M-O-N-K, fruit, and it comes down in little rip packs just like your stevia. That doesn't have as much of an influence on your insulin. The other biohack with insulin and sugars and sweeteners is a ton of fiber. So if you want to try to lose weight, just give yourself a big thing of fiber and do fiber with every meal. Fiber makes you feel fuller, but it also does not allow your body to absorb sugar as quickly, which means you don't spike your insulin as much. So fiber is another biohack to weight loss plateaus because it slows down your absorption of any carbohydrate you get and doesn't make you store stuff. But yeah, I love sweet stuff too. So I'll do a little bit of monk fruit in my coffee just to make it sweeter with a little bit of whole cream, because whole cream is a fat. There aren't a lot of carbs in whole cream. So there's ways to still get your little sweet tooth in there, but to kind of cheat a little bit too. But if you're cheating all the time, you're gonna have a high insulin level and you'll never lose weight. Does that kind of make sense? Yep.
Just going back then to the health of America. I guess, where do you think we can start? Even looking in the grocery store, it seems like so many people are incentivized to have Americans unhealthy. Like the grocery store, it seems like 80% of it's kind of junk. So where do you think we should start, even just as a country?
That's really hard. I mean, it's gonna start with you as an individual. It's gonna start with you guys as a company. You know, these kind of health initiatives, I mean, whoever's in charge of this should do a health challenge with all of you, saying, hey, let's do the 6 elements of health together. Let's do some challenges. Let's talk about it. Let's do a group breathing techniques, because if you're healthier, right, then your kids are healthier. Then your sister sees you on Facebook, man, she looks so energetic and I'm stressed out. What are you doing? So it really starts with, you gotta change in yourself. And then when it comes to the grocery store, you vote with your dollar, right? So you can either go in, you can buy the Doritos, or you can buy the kale. and you can buy the more expensive milk or you can buy the cheaper milk, right? But when you look at all that stuff, there's a lot of politics in milk and there's a lot of politics in foods too, so I want to get into that. But you vote with your dollar, so prices will come down when we buy healthier things, but you got to just live the life. You've got to blast it out there. You've got to be the spokesperson for yourself. If you're in social media, let people know what you're doing. Hey, I've decided to do this. I'm doing these 6 elements, or I'm sleeping more, I'm eating different. Things spread like wildfire on social media. So it's hard to change, but you have to change this first, which is your mindset. When you're motivated, she's motivated because she sees how happy you are. It's just one thing at a time. It's really hard in society. I mean, get involved, right? So be on the PTO at school and say, hey, I don't really approve the fact that you're doing French fries, you have 10 carbs here, you have 0 proteins, and the fat you're giving them is vegetable oil-based fat. So get involved in your schools, get on boards. I mean, there's a lot of ways you can get involved and start having some influence, especially if they know, hey, I'm passionate about this and I work in healthcare, I'm part of Blue Cross. You already have a platform because of your job, and then use your platform to start talking. But you have to be vulnerable too, because in your public speaking, then people are looking at you, but it is a tough one. Changing society is really difficult, but it starts with companies, right? Because companies can influence. I mean, I was surprised how many people work for Blue Cross when you guys were talking to me. You guys have the ability to, as a company, you guys have the ability to influence more than just you. My goodness, imagine what you guys could do if you started promoting some of this stuff as a company. And I don't know much about insurances, but I know it's competitive out there and that people can shop around. If you say, hey, Blue Cross offers not just this, but here's the 6 elements of health that come with each one of your guys' insurance premiums. We're gonna give you online access to the ability to change your health. People are gonna consume a lot less more of your Blue Cross dollars, and you'll have much more reserve. You'll be able to decrease your premiums because everybody's mad at you, and you guys know that, right? You can laugh, I'm not, but you know what I'm saying? People are complaining that their premiums are so high and you guys can't help it. You've got to pay for the strokes, the heart attacks, the hospitalizations. Those are very expensive. Why not offer as a company and talk to whoever's in your company that can have influence and say, why don't we as a company offer something that's outside the box, right? I'm comfortable as a doctor being outside the box. Blue Cross Blue Shield at some point needs to be outside the box as well, because things are becoming competitive with you guys as well. But when you say, hey, we're not just providing healthcare, but we're also teaching you how to become healthy, my gosh, you have a ton of influence.
Hi.
Okay, one here, then I'm coming back to you.
Question for you. Stem cell treatments for senior citizens, so like even in their 80s, particularly for knees, where they haven't done a knee replacement, but it is basically bone-on-bone type of situation. Are they effective? I've got some aging parents, so.
Yeah, so stem cells are really cool, kind of interesting. I had a patient yesterday, I think she was 75, and she has a very healthy lifestyle. And every time I do a bone marrow harvest, I'll count. We have a cell counter that we're able to count how many cells they produce. And she set my record for the most stem cells that I've ever seen. She had 4.6 billion cells that she produced with my bone marrow harvest, and she was in her 70s. So age doesn't make a huge difference. It does slightly decrease success as you get older. But again, that's because usually as we get older, we're less healthy. You can, again, get around that by encouraging your parents to eat healthy, they'll have healthier lifestyles. So when it comes to success rates with stem cells on knees, it's somewhat related to severity of arthritis. So most patients that come to see me, they're bone on bone. They are very degenerated. They're supposed to get a knee replacement. They're too old or they don't want to go through the time off and such. And we're still having good results with that. So the age doesn't make a difference in my mind. It's really the protoplasm that I'm working with is what's going to base my success rate. So that's why I talk so much about getting healthy, because people come to me, they expect so much out of me. I'm like, hey, I can do what I can do, but you have to do a little bit as well. We become partners in this. So get them healthy first and their success rates will go up. Yep. Oh, one more. He's excited too.
Always. So I have a question. I just got off a 10-day green smoothie cleanse, which I lost 12 pounds in 10 days, but it changed my mindset. My mind on eating now is not, I want junk food, I want fruits and vegetables. Cool. Yep. I want, healthy stuff. Is that a good way to go about, losing weight?
It is, yeah. So when we talk about weight loss and we kind of do our weight loss programs is we kind of have an initiative or an initial thing, and that's mindset. We don't start off about, okay, let's get in here, let's do boot camps, burpees, because then you're gonna be like craving sugar, you're gonna be fatigued, you're gonna be tired. You change the simple thing, which is the mindset. So what you didn't even know it, is by doing the 10-day thing, it was challenging, and you had to give up some stuff, and you probably crave things at times, but it made you, I can do this. And then you had a goal, which was the 10 days of doing it. Now that you're done, like, hey, I actually felt pretty good. I think I can do this on a more regular basis. So what you changed was, yes, you lost 10 pounds, but the most successful thing you did is you changed this directive. And so yeah, it's really important. Yeah, it's a great way to do it is, okay, give yourself a goal, like a short-term 10-day goal. Okay, in 10 days, I'm gonna decrease my sugar consumption by half, or I'm gonna do a smoothie cleanse, or I'm gonna do just vegetables for 10 days, and then I'm gonna start on whatever meal plan or nutrition lifestyle is best for you. We're not gonna diet. We're gonna change our lifestyle, because this is gonna be long-term for us. But that was a good idea, you did good.
Health perspective, I've actually got chronic conditions, a lot of healthy chronic conditions. So I've actually been on a vegan diet for the past 7 weeks.
Oh, can you bring it up? I just want to make sure I hear the whole question. Sorry.
Because I have my chronic conditions, I've actually had to go on a vegan diet for 7 weeks. But my some of the other health issues that I've had, because being an athlete, younger, needing knee surgeries and stuff like that, they already took out the meniscus 30 years ago. Now it's coming to a point where I'm in my 50s, and it says, well, there's going to be a point where I'm going to have knee surgery. Now you have this stem cell. And he did address some of the questions about at what age do we know that we need the surgery to go through all that versus doing all these investigative and or new technologies, and is it going to be beneficial at my age? I can see it if it was in my 20s, because I have another 50, 60 years to live, but now I'm only looking at maybe 20, 30 years.
Yeah. Good question. So, and you're still, in the realm of orthopedics, you're still very young. When it comes to joint replacements, you're still very young. So when you look at a joint replacement, you're gonna get 10 years. If you're really active, that joint's gonna still wear out. Nothing's permanent when it comes to replacements. And it doesn't mean a replacement is wrong or right, but it's gonna have a half-life as well. If you're 50 now, you're still super young. You should be 60, 70 before you start thinking about joint replacement, because it's only gonna last you 10 years. If you're active, it's gonna last you less. So a lot of stuff what we're trying to do here is also to get people a little bit longevity with the anatomy they have, because it's going to, technology is always changing as well. What I do now is not what I did 3 years ago. So even what I'm doing is advancing. What we're doing with joint replacements is advancing. So the longer you can prolong and have the anatomy you have, be comfortable, be active, be fit, be happy, go hiking, go on vacation. If you can have that lifestyle for longer, that's what you want. So you want to make decisions and do things that are going to enable you to extend what you currently have. And you're not old. I guarantee you 50 is still very young when it comes to orthopedics, because the average person is living into their 70s and sometimes 80s if you're healthy. So.
I know I can't stay on that. It's just unsustainable. I mean, veganism is a lifestyle that I would never ever recommend anyone.
It's hard.
I know that, but because of some of the medications that they have put me on, I'm able to sustain that for now. But I know I can't go back to a meat and red meat diet, because my cardiologist says absolutely not. I mean, he says I'll be lucky to make it to 70 because of my conditions.
Sure.
So there's so many diet plans or plans out there, the keto, the paleo, all of that. How do we know how many books do we have to read? How many doctors do we visit to find out what's right?
That's a really hard question, and here's the answer to that. So you would be really good being a partial vegan. So it means being a vegan 3 or 4 days of the week. You already know the lifestyle, you already know how to cook, you already know how to make things taste good. And take 3 days and be more of a pescatarian, which means maybe have some fish, so you're getting those good omega-3s. If you're having fish, make sure it's smart choices, right? Make sure they're wild-caught fish, not farm-raised, because the farm-raised are high omega-6s. The wild fish caught naturally are high omega-3s. There's not a lot in fish. There's not a lot of people that have a ton of fish allergies or problems. The only thing in fish you gotta make sure of is it's the mercury levels. So you wanna make sure that the fish you're eating is not an old fish, it's a 1 or 2 year old fish. So salmon is salmon only live 3 years. They don't have enough time to get a ton of mercury. So eggs, if you're doing organic, free range eggs, that is the #1 source of protein is an egg. It's got a lot of good stuff in there. Yep. Yeah, it's a tough one too, because I don't know all of your health conditions, so it's hard for me to say why he said that. But It's hard. Those are hard things to do too, to be vegetarian, because if you're diabetic and you're eating just vegetables, your carb load is 200 or 300 grams of carbs a day. So I don't understand why someone would give you a high carb diet for diabetes. Oh, sure. Yeah, the other thing you might want to do is get some genetic testing, because that's the next thing on our list is like, I don't know how to eat. There's some genetic tests you can do. Just look up nutritional genetic testing. It'll tell you the diet that's best for your genetics. That's the next level.
Well, Dr. B, this has been amazing. We could stay here all day and ask you questions. Or maybe you can come aboard so we can use you as a doctor.
Yeah.
So we want to thank you here. And for those on Skype, we are sorry we couldn't get your questions in. But if you have questions, please type them to us and we'll send them to Dr. B. And he'll hopefully be generous enough to answer them. So you know, our company is invested in our health. So we have Miss Christina Wedelin from Health and Wellbeing Solutions to share with us what their company has to offer. But before that, help us all give Dr. B a great round of applause.
Thank you, Dr. B. I just wanted to take a couple minutes to let you know, for those of you that don't know, about ShareCare, because a lot of things that Dr. B said were actually starting points for the ShareCare platform, and where you can at least start tracking your behavior, track your steps. If you've got a device, you can sync that up to actually see how many steps you're getting a day. It's those baby steps, and it's starting someplace. Maybe you're not the CrossFit guru, but you can be met where you're at with the ShareCare platform. So I would encourage you, if you haven't registered, we made the registration process easier. And then we also have what are the base platform assets that are available to you, the components within the base platform. And then that will set you up for being registered and ready to engage next year when we learn what employee group will be doing for their, if they have an incentive program, or just how they will be using the platform next year. So stay tuned for that. But I have handouts up here if you'd like to grab one. Thank you so much. Have a great day.